Hello, I'm Dr. Charlotte Middleton and welcome to today's video on skin cancer. Now, it's actually Melanoma Awareness Month this March in Australia, and we're also just coming to the end of our summer here as well, so it's a particularly relevant topic right now. And aside from anything, Australia actually is the skin cancer capital of the world, and we've got the stats to prove it. Now, over 750,000 Australians are treated for skin cancer here every year. That's over 2,000 people every day. Skin cancer accounts for over 80% of all new cancers of cancer diagnosed in Australia each year, and 2 in 3 Australians by the age of 70 are diagnosed with skin cancer. Perhaps most shocking of all is that the most commonly diagnosed cancer among adolescents and young adults, that's 15 to 29 years, is melanoma. So pretty sobering statistics. Now, what we know is that sun exposure is the cause of around about 99% of all non-melanoma skin cancers and 95% of melanomas in Australia. However, what we also know is that exposure to small amounts of sunlight is essential to good health. And we need that balance between avoiding an increase in the risk of skin cancer by excessive sun exposure and achieving enough exposure to maintain adequate vitamin D levels. I'm going to talk a little bit more about that in a moment. Now, the risk of skin cancer is increased for people who have, say, an increased number of moles, so they're often called dysplastic nevi. If you've got fair skin, a tendency to burn rather than tan, you might have freckles, a light eye colour, light or red colour hair. And if you've also had a previous skin cancer, you're also at an increased risk of developing another skin cancer in the future. Let's have a look at the actual types of skin cancers out there. So we've got non-melanoma types such as basal cell carcinoma and squamous cell carcinoma, and then melanoma. Having a look at basal cell carcinoma, it accounts for around about 70% of all non-melanoma skin cancers, and it begins in the lower layer of the epidermis, which is the upper layer of your skin. It can appear anywhere on the body, but mostly appears on the parts of the body that receive high or intermittent sun exposure. So that's your head, your face, your neck, your shoulders, and your back. Now, often it has no symptoms and they tend to grow very slowly without spreading to other parts of the body. Some of the symptoms of a basal cell carcinoma, however, may include it looking rather pearly, or it can look like a scaly kind of dry area that is shiny and pale or bright pink in colour. Squamous cell carcinomas, on the other hand, account for around about 30% of all non-melanoma skin cancers, and they begin in the upper layer of the epidermis. And they usually appear on the skin which has had the most exposure to the sun, so the head, the neck, the hands, the forearms, and the lower legs. And they tend to, unlike basal cell carcinomas, they tend to grow very quickly over weeks or months. Some of the symptoms of this skin cancer can include things like a thickened red scaly spot, a rapidly growing lump. It can look like a sore that just doesn't heal or go away, and they actually may be tender to touch. Now, having a look at melanoma, melanoma is a type of skin cancer that usually occurs on the parts of the body that have been most exposed to the sun. There are also rare melanomas that can occur in areas of the skin that haven't been exposed to the sun, such as in between your toes or underneath your feet. So it's really important to check there as well as part of a skin check. Now, melanoma is the 4th most diagnosed cancer here in Australia, and along with New Zealand, we have the world's highest incidence rate for melanoma. So it's really important that we're aware of it. Melanoma is more commonly diagnosed in men than women as well. Now, it often has no specific symptoms, however, it can be associated with changes in a skin lesion according to A, B, C, D, and E. Now, A is for asymmetry of the skin lesion, may have an irregular border, so that's the B. C for an uneven colour, and D for diameter. They usually can be they're usually large and often over 6 millimetres, the ones to watch out for. And E is evolving, so the lesion often is changing and growing. Other symptoms can include dark areas under your nails or the membranes lining such things as your mouth, vagina, or anus. The most common sign of melanoma is the appearance of a new mole or a change in an existing mole. And this can happen anywhere on the body, but typically happens on the back, your legs, your arms, and the face. And in most cases, melanomas will have an irregular border or a change in colour, or more than one colour. And they may also be larger, as I mentioned, than normal moles, and can sometimes be itchy or bleed. So all things to look out for. As I said, what we know is that melanoma is increased with an increased UV radiation or overexposure to sunburn, and particularly sunburn that's occurred in childhood. We also know that some people have an increased risk for melanomas, and much the same as the non-melanoma skin cancers. It can be if you've got an unusually high number of moles, if you've got light skin that burns easily, light colour, freckles, light or red hair colour. Also, if you're immunocompromised in any way, shape or form, that can increase your risk. And a family history of melanoma in a first-degree relative will also increase your risk. And if you yourself have had a previous melanoma or a non-melanoma skin cancer, that will also increase your risk. So, look, at the end of the day, we all need to be sun smart. You don't overdo it, but as I mentioned, there is a nice balance that we need to get some vitamin D with some sun exposure as well. And look, I tend to have a rule of thumb that when you're out in the sun, the first 5 to 10 minutes, arms and legs exposed with no sunscreen on them, do apply sunscreen to your face and wear a hat. And then after that 5 to 10 minutes, pop on your sunscreen then and keep popping it on for the rest of the day. That's giving you a nice little exposure and got some vitamin D going, and then you're protected for the rest of the day. Just a quick mention I should make about solariums. They do not protect you. They give out the same amount of radiation that you're getting from overexposure to the sun. So please don't think that solariums are in any way safe. And also just be aware that fake tans do not offer you any protection from sunburn. That's often a common myth and one that needs to be dispelled. So they do not offer you any protection. Look, at the end of the day, if you have any concerns about a skin lesion, you need to go and see your local doctor, or there's plenty of skin cancer GP-run clinics around as well. So pop into one of those. You don't need a GP referral to go and to see a doctor in those clinics. Any concerns, please go and see your local doctor or go to your local skin cancer clinic. Thanks for watching today. I'll see you soon.